Hey everybody, happy Tuesday. It's Emily Dodds Yenor here with 1212 Bodyworks. This is the last Tuesday Toesday tip. Thank you so much for all of you who have joined in on these videos and who've watched the replays throughout the months of April, May, and June. I can't believe we're like at the last day of June. It's so crazy how time is flying by. So thank you for all of your support and for your comments and questions. Today is going to be just a Q&A. So if you hop on here live and want to ask me any questions that you might have about the feet, I will do my best to answer those questions. If you have questions if you watch the replay and if you have questions, shoot them at me in the comments and I'll get back to you on those as well. Because if you have a question about it, chances are somebody else out there might also be kind of wondering the same thing. So don't be afraid. There's no bad questions. It's great. Anything you're wondering about, just let me know. Hey Jenny, how are you? Do you have any questions for me, Jenny, about your feet or feet in general? If so, let me know in the comments. So I do have a couple of questions that were submitted prior to today. Yay, Jenny, thanks for catching me live. I love it when you're on here. It's awesome. So I have a couple of questions that were submitted prior to today. So I thought I would start by just addressing some of these. And these are questions that I get a lot. So I thought these were good ones to address here. Now, if you go back into some of the other videos that I've done over the last couple of months, you may find that other questions will be answered for you there. Some of the things that I'll talk about today, I do address in some of the previous videos. So feel free to look back and I'll try to remember which videos it was that I kind of addressed some of these things on. But anyway, the first question comes from Amy in Illinois. She wants to know, oh, hey Mia, how are you? Glad you're here. And thank you. I've enjoyed having you on here for my Tuesday Toesday tips. Okay, so Amy's question is, what can I do for ingrown toenails? And so that is a good question. Typically, you'll go to a podiatrist to have the corner of the toenail, for lack of a better word, I guess, cut out of the skin. The skin starts to grow around the toenail, or the toenail will start to grow into the skin. That really is an issue for a podiatrist to correct. However, as a physical therapist and as a foot specialist, of course I have Tootsie here today to show, if you are bearing weight in a way that then puts more pressure on that corner of the big toe, I think that might be one of the most common areas to get an ingrown toenail. If you are walking, with a lot more excessive weight through that big toe, that would have to be corrected and addressed. And so that could actually, if we address that, whether it's something in the foot, the ankle, the lower leg, knee, hip, opposite shoulder, who knows, if that mechanical dysfunction could be addressed, that could help to take some of the pressure off of it. But otherwise, I don't do ingrown toenail removal in the clinic here, so I don't know how to do that. So that's for a podiatrist, but I can help you correct how you're bearing weight through the foot. So good question, Amy. And what about toenail fungus? Again, that's kind of either a podiatrist issue or typically I believe that fungus comes from within. I don't believe that it's something that we can just, put tea tree oil on the toenail for and it'll go away. I really do think that there's a deeper, more internal fungal infection happening in the system that needs to be addressed either through supplementation. It's not my scope to know about the medications that are available for that, but usually it's kind of an inside job. Whatever is happening in the toenail in terms of a fungus, I believe is actually coming from someplace within the body and the body's trying to get rid of it. And so that tends to be a good exit point for it. So I can't technically do anything for fungus, but I have a lot of people that I know that are functional medicine specialists and that can do testing of different types to see like where is this fungus coming from and then how can it be best treated. So if you're interested in information on those practitioners, just again, let me know in the comments. Okay, so another question we had, what can the work that I do, what can I do to help neuropathy in the feet? Oh, hey Michelle, how are you? So glad you're here. So neuropathy is interesting. Oh, and Amy's watching too. Hey, Amy. Hopefully you heard the question from earlier. Thanks for being here for the Tuesday Toesday Tip Live. So neuropathy is kind of it's not a fun thing to deal with. There are a couple different types of neuropathy. So for people who are diabetic, over time their nerves will start to kind of die off in the feet, and so then they can't feel things as well, and they can't like hot and cold, and just even pressure will not be felt as evenly through the feet. So this can become a balance issue. If you can't feel the ground underneath you, obviously other things are going to have to compensate. So if it's a diabetic neuropathy, that's a little trickier. I think, again, medical management, diet, lifestyle management for people who have diabetes is really the way to go to help minimize those neuropathy issues. If it's a balance issue because of the neuropathy, there are tons of exercises that we can do here in the clinic. I can teach you how to do things at home. And once again, the philosophy that I follow is treat the body as a whole. So we would figure out where are all of the different instabilities coming from? Because chances are it's probably just not coming from the feet themselves. The feet are connected to the legs, to the knees, to the hips, to the pelvis, to the spine. You've heard me talk about this for 3 months now, so it's nothing new. You got to treat the whole body as a whole to balance the system, the whole body system, to take pressure off of the feet or to just help the feet feel better underneath you. So there's diabetic neuropathy, and then there's also peripheral neuropathy. And peripheral neuropathy is more of when I think sometimes it can happen when there is pressure on the spinal cord, and then sometimes it'll cause the nerves that go down into the legs to not be able to function and fire as well as they could be. So a lot of times people who have neuropathy in the feet like that definitely are going to need core strengthening, pelvic floor strengthening. Is their pelvis even aligned correctly? We have to look and see about that to make sure that you're bearing weight evenly and that the spinal nerves that come out of the back are as free flowing as they possibly can be. So neuropathy, again, it's a whole body problem, even though you may just feel the effects in the feet. Okay, next question is from Colleen in Wauwatosa. What do we do for flat feet or fallen arches? Oh, hey, Debbie. How are you, Debbie? Are you still doing yoga these days? I wish that we could do yoga together. I miss you. Thanks for watching. So what can we do for flat feet and fallen arches? So here's Tootsie again. So the arches of the feet, if you look at the underside, we've got a couple of different ones. We've got one that goes this way. We've got another one that goes this way, just to keep it simple. So when those flatten down, it makes it really difficult for our body to absorb shock. Our feet basically serve as there's two main functions that our feet serve. They absorb shock, so they fall into pronation, which is into a little bit of that fallen arch position. Pronation is what helps us absorb shock, and then we supinate, or we go into a higher arched position to then push off with our foot for gait. So we want to be able to do both of those things. So if your foot is kind of stuck in this pronated, flat, fallen arched position, you'll be able to absorb the shock in the body. But if you're stuck like that and you can't supinate, chances are you're not going to be able to push off as well from the foot. So then you'll have to push off a little harder from areas in the upper part of the leg, whether it's the knee, the hip, or the pelvis, or the opposite spine. We don't always know that until we assess, but if the foot stays flat, it's not going to help you push off as well. And sometimes then it'll absorb too much shock, and then you'll feel like shin splints and stuff going on in the lower leg because it's getting the forces are being absorbed too much in this area and not dissipating throughout the chain. So what we do is I figure out, again, where are the weaknesses coming from head to toe. Are there specific foot muscles that are in the arch? We've got so many different muscles in our feet, and we can check a lot of different specific muscles and positions that the foot can get into to see where is the where is the asymmetry coming from, and then either using exercise or hands-on techniques, we can get those muscles stimulated and kind of bring your brain and body's awareness back to those areas. And then tons of things that you can do at home. There's towel scrunchies, a lot of different exercises. In fact, there's an exercise class that I just shot the video for that if you stay tuned on my my personal Facebook page, and then I'll also post it to the 1212 Bodyworks business page. As soon as that is ready, you can take it. It's an online class through a brand new company. I'm really excited about that. So there'll be lots of exercises in that video for strengthening the foot and helping to keep that arch up. So that's what we do for flat feet and fallen arches. Okay, so Kathy in New Berlin wants to know, can bunions truly be reversed without surgery? That is a really good question. It is not easy. I'm not gonna lie. So a bunion, we talked about in one of the first videos. The bunion is where the bone here and we call this the first ray. This is the basically the big toe joint here. The big toe starts to go toward the second toe, and then this bone out here kind of, it rounds out. So you might have one, you might have seen somebody that has a bunion. Podiatrists and orthopedic doctors can do some surgery to correct the bone alignment. And that's a pretty intense surgery in my mind. So it's a tough question to answer. Can the bunion be reversed without surgery? It's a huge commitment, but if we can get all of the muscles that are working, we did that little bunion buster exercise where you basically, reach the toe back and forth, in and out kind of. That's one way to strengthen this muscle here. The whole foot mechanics would need to be considered. Are you a 4-foot weight bearer? Are you putting too much weight on the ball of your foot versus bearing it through the whole foot or a little bit more through the heel? That would also make things better. So there are some things that you can do to minimize the stresses at the bunion area. And if you can minimize the stress, some of the pain that's associated with the bunion can potentially be minimized. But to say that you can reverse it, I honestly, it's like I said, it's a huge commitment to correct all of the mechanics up the chain that could be contributing to that. I think we can for sure do some work with physical therapy and the specialties that I have to reduce the load on it. And that being said, if your inflammatory load is higher, so if you're eating a lot of inflammatory foods, if you're under a lot of stress, if you've been, really hard physically, if you've been really hard on your feet physically, like walking a lot or running a lot or standing on firm surfaces that are uncomfortable for you, that can also create more of that inflammatory response in the body, and then create more symptoms. So if you can minimize inflammation, minimize even, with all the talk of the virus in the system, I think even reducing our viral load. So this might be a topic for a whole other video, but you might even see on my hands, I have this thing called vitiligo. It's an autoimmune issue. But in all of the work, all of the reading that I've done about immune system health and boosting health for autoimmune issues, there is a book series, The Medical Medium. Some people are not into his way of thinking, but of all the things that I've read, it makes a lot of sense to me. And so he talks about reducing your viral load. So the foods in your system that actually feed viral tissue. So a lot of times the viruses, I think, can settle into our joints and start to eat away at our joints. So this may seem a little controversial for some, but minimizing things like eggs, gluten, dairy, corn, soy, pork, and canola oil will take away, those are direct food sources for viral tissue. So a lot of people aren't really talking about that, but it's all about, the medical medium goes into it and has all sorts of really wonderful recipes and things. So minimizing your viral load, minimizing your inflammatory load can not only help pain at the bunion site, but also just joint pain in general. So anyway, I might be opening another can of worms on that question, but if you have questions about those topics, let me know. And then the last question, anybody else have questions here that's watching live? Let me know if you have them. My last question is, how exactly do you help the foot with your treatments? Okay, so that is a good question. So again, as a PT, I'm trained from head to toe. I just happen to really like feet. So I always take a full body approach when working with my clients. So the assessment process that I use involves looking at your alignment from head to toe when you're standing. So I'll look at you from behind, from both sides, and also from the front. Take note of, how are you bearing your weight? Is one foot rotated out more than it is in? Are the knees, are the angles of the knees even? Is the pelvis symmetrical? Is one shoulder higher than the other? Is the head turned or tipped one way? So we take a look at the whole posture and alignment in standing. I also have you on the table right behind me here, my treatment table, and I'll look at your alignment out of gravity. So I'll also take note of all of that. I'll look at some stability tests to see how your muscles are firing in different positions. And then I do a full body range of motion screening. I'm, once a PT, always a PT. These are goniometers. These measure joint angles. And look at this adorable, cute little tiny one for the feet. So you can measure toe angles and just, you line it up next to the bones and then measure how far things are moving. And then I'm always looking for asymmetry. So we want your body to move as symmetrically as possible. And none of us are perfect. All humans are going to have, we're either right-handed or left-handed. Even if you're ambidextrous, you still favor one side or another. So we're looking for asymmetries. And then I come up with a treatment plan that will address, your specific issues. Are you having pain someplace? Are you having functional deficits? Is it hard to go up and down steps? Is it hard to wear shoes? Is it hard to bend over to pick up your grandkids? You name it. I'll take that all into consideration. But then based on how your body presents during the assessment visit, I come up with a plan as to how are we going to move forward with this. And so then I present you with that plan, and then we move forward with treatment. So again, treatment happens on this table. Typically, there's a little gym in the room next door to this room where we'll do some progressive strengthening exercises. And I do a lot of educating for you because as a client, my goal is to get you to not have to see me that often. I know that sounds kind of weird as a business model, but yeah, my goal is to teach you how to fish rather than just feeding you fish. So I want to teach you about your body. That's why I've been doing all of these videos. I want to teach you as much as I can about your feet so you can take matters into your own hands, but then also know when it's time to see the pros and get some professional help. So thank you for watching, Nancy. Thanks so much for being here. And Lizzie's watching too. Hi, sweet Lizzie. How are you? So that's basically what I do. Typically, I'll see patients initially like one time a week or so, and then as time goes on, we see each other less and less frequently as they have more things to do on their own at home. So that's how I work with people. Again, these videos have been all about the sweet feet, but I can help with any sort of muscle imbalance issues, pain issues, functional limitations from head to toe. So anyway, thank you all for being here today. Thank you for all of you who have watched the Tuesday Toesday tips in the past. If you have any questions about anything that I didn't cover today, and you want me to just send you the answer in a private message, you can always private message me here on Facebook. But don't ever hesitate to reach out if you need me, and I'm still open here in Brookfield, so if you are comfortable coming in for one-on-one sessions, I'm offering those. Some things are pretty challenging, I will say, for a virtual session, but we can certainly try those too. So anyway, thanks again for all of your support. I hope that you continue to take good care of yourself and your feet and each other. Take care.